My name is Dr. Mel Irvine. I'm a provider located here in Southwest Florida. Today I'm going to talk to you about a very common question that I get from male patients that come into my clinic, and that is how to increase ejaculate volume. This is a big concern for a lot of my patients. You know, we live in Southwest Florida where we do have an aging population, but I have a lot of young patients too, from like 20 all the way up to about 90. So as men age, their ejaculate volume begins to decrease and their refractory period also becomes prolonged, their recovery period. There are two stages to ejaculation. There's emission, where the sperm is pushed into the prostate and the urethra, and then expulsion, where the sperm and the semen is discharged from the urethra and ejaculated out of the penis. Men can also have other types of ejaculatory disorders. In particular, there's another one called retrograde ejaculation, where they're ejaculating, but the ejaculate isn't coming out of the penis. It is actually backflowing and going into the bladder. You know, most of that fluid comes from the seminal vesicles, which hold about 1 to 10 mLs of fluid, and about 80% of the secretions come from there. And then the rest of it comes from the prostate itself. The average volume of ejaculate from a man is about 1/4 teaspoon to 1 teaspoon. So we're not talking about a lot of volume anyway. And, you know, the younger the man, generally, the more ejaculate volume he has. It's important for men to understand that ejaculation and orgasm or climax are not the same thing. We typically tend to associate them as one and the same process, but they're not. Men can be multi-orgasmic as well, where they can climax multiple times without actually ejaculating. So what do we do about it? There are some studies that show benefit to certain supplements. We'll get to what those are. Number one, hydrate. Fluids, water specifically, is very important. That's one of the biggest problems I have with my guys, is hydrating. Even though it's in our Monsters and our Gatorade and our beer, it's still not water. You need to drink water, and preferably spring water, because there are naturally occurring minerals and elements in it that are very important to sperm quality and health as well if you're family planning. Some of the treatments that are used for increasing ejaculate volume are not FDA approved. They're used by some fertility doctors actually to increase ejaculate volume in men and improve sperm motility. There's some amino acids that are important for that process. One that is used is N-acetylcysteine, NAC. It's a supplement that you can get over the counter. And there are studies that show that this particular supplement will increase ejaculate volume, improve sperm motility, reduces oxidative stress and inflammation. You can get it naturally through your diet from sources like poultry, eggs, soy, and some grains. L-arginine and L-carnitine are also other amino acids that are used to increase and improve the sperm quality for any men that are family planning. There are essential vitamins and minerals that are also important, such as vitamin D, vitamin E, folic acid, zinc, selenium, all affect sperm quality and health. There's one study that shows that there may be benefit to using ashwagandha root in increasing sperm volume and improving sperm motility. But that's just one study, so they still need to look into that. There are other benefits to ashwagandha root. It's important to know that whenever you're considering taking a supplement, you should be discussing this with your medical providers, as well as understanding that when you do this, there is no instant gratification. These are supplements that you have to take for a long period of time, 3 months or longer, to get benefit from any of them. Other techniques and things that can be done, you can, you do Kegel exercises. Those are essential because as men age, their pelvic floor muscles begin to weaken, and that's very important in the process of ejaculation. So strengthening those pelvic floor muscles is very important. Lifestyle changes, like quitting smoking, because smoking has been shown to reduce prostatic secretions, and other comorbidities like cardiac disease, diabetes, things of that nature can also affect the volume and quality of your sperm. You want to look at your medications, because there are some medications that decrease the semen volume or cause retrograde ejaculation, such as finasteride or alpha blockers like tamsulosin. But you have to look at risk versus benefit. If you need the medications, then you have to consider that. You know, what side effects are you willing to deal with when you're on those medications? Or you have to look at what symptoms you're having to see and decide which treatment is the best choice for you. You know, men also, if you were to prolong ejaculating, like go a couple of days, yeah, you'll have more ejaculate volume. But there are studies that show that men that ejaculate 21 times a month or more have a decreased risk of prostate cancer. So if you're ejaculating every day, you are going to have less volume, but I would think that that's a good problem to have. So you have to consider that as well. You know, what are women thinking about this? Yeah, it's important to us. You know, 50% of women do feel that it's important that their male partner does ejaculate, but there are other parameters of intimacy that are much more important to women. So again, it is good for you to ejaculate every day, so you have to consider that. If you like what you heard here today, definitely, you know, subscribe to our YouTube channel at Dr.Mel Irvine. You can get on our website at drmelirvine.com. I have another website that's educational material for sexual education purposes, and that is sextys.com, sextys.com. You can also contact us. Text us is the best way to do it at 239-351-5663 if you're in the area locally or want to establish care or just need a 10-minute free consult. Thank you for listening.